Thank you. Thank you very much. Oh, folks, thanks for having me. I'm sure you're very tired, so I'll get on right to it. A little bit about myself. I was training to be a GP in the 80s while working in orthopedics. One day there was a strike of the porters, and that day I was stationed in the theater, operation theater, with Mr. Gorzak, God rest his soul, great surgeon, great orthopedic surgeon. And it was the last patient, and he was nearly 16, 17 stone. And we had done his hip surgery. And you see, mandatory, once the surgeon has done his work, he lets you close the leg, and I was doing it duly. The matron was there. It was the last case, so they had forgotten completely that the porters were on strike. So they left the young nurse and me with the patient. When I had finished stitching, there was nobody to help us. And the ward was far away. And we couldn't get them on the phone because, you see, the nurses were in different places in the ward. So we decided foolishly to pick the patient and put him on the stretcher. So poor nurse let go, and he came on me. So I heard a crack in my back. After that, 3 orthopedic surgeons who I was working with, they all looked at my back. They couldn't do anything about it. I was on a fistful of Ponston. At that time, Ponston was the only thing which was given for pain. And they made my stomach so bad that I had to start anti-ulcer medicine. So I couldn't walk. In Merlin Park Hospital, the hospital one was on the stairs, no lift, so I couldn't go up. The patients had to come down for me to, take history and do things. Couldn't go to the theater. So anyway, they decided they'd do some exploratory surgery on me. But before the surgery, I was invited to a wedding in London. A friend of mine, a gentleman from Mayo, was getting married, who I met in college. So at his wedding, while walking into the church, there was another doctor behind me. He says, "Why are you walking crooked?" So I said to him, "Listen, I just hurt my back and I'm just waiting for surgery." So he says to me, "Why don't you come to my clinic? It's not too far from. You know where St. Thomas's Hospital is in London." His clinic was not too far from there. So my friend said, "Why don't you go over? He's good." And I said, "What is he going to do?" He says, "He does acupuncture and stuff." So exactly, that's what he said, acupuncture and stuff. So I said, I have nothing to lose. So next day, I was at his clinic, and he looked at me, and he just put some needles in, and he gave me a few bottles, and he says, "Go on, come back tomorrow." So I was there for 3 days, and he gave me 3 treatments, and I canceled my surgery. So that day, I decided not only no surgery, but I knew there was something in it. And after that, my job in orthopedics, when it's finished, so I went over to the psychiatry. So you have to do all different ones: medicine, surgery, pediatrics. I did post-graduation from the Royal College of Surgeons in pediatrics. I then went and did orthopedics, chest medicine, cardiology, you name it. And the last one was psychiatry. And in psychiatry, initially, we had a lot of time. So I just said, a friend of mine rang me, he says, listen, we doctors are getting together and we are going to do and organize this course in alternative medicine. And I just said, what is alternative medicine? And he says, the acupuncturist. So I said, yeah, that's a good one. So he said, will you come? And at that time, because you were a young doctor, they said, you need 3,000 pounds. And 3,000 pounds was a lot of money in the 80s. It was very, very difficult for us. So look, we borrowed, we did a lot of extra time and work, and we got into this course. So there were 6, 7 doctors, we just got on that course. And we went to Austria, we went to Germany. In Germany, we learned neural therapy. So doctor was saying that about this syringe. This syringe I used in 1988. That syringe, the air jet syringe. But we were injecting procaine in points, and the results were phenomenal. But then procaine was banned for that use. So I still have that syringe, but it's made up of steel. At that time, you know, there were no Alibaba or AliExpress, and it was made in Germany, and it was very expensive to buy. It was nearly 300 pounds at that time to buy that syringe, but it really worked well, really worked well. So after that, we did a crash course in chiropractic, osteopathy, acupuncture. It took us 3 years to finish our alternative medicine course. But I'll tell you now, I never looked back. I have never, ever, ever looked back. I opened my first clinic, complementary clinic, in 1989. And initially, my friends were saying, this is a bloody pish rogue. What are you trying to do? You know, you have a good job. Hospital is paying you. What the hell do you want? Anyway, I just made up my mind, and the people who were given out to me, oh yes, I wrote my first article on probiotics in 1989. I wrote my first article on candidiasis and chronic fatigue in 1989. I have it still framed. And then the ICGP asked me to give lecture to about 30 GPs from County Galway. And I was able to do that. And touch wood, there's still about 3 or 4 GPs who were on that talk, and they converted themselves to the complementary medicine, and they're still doing it. And then we are still in touch. By the way, the 6, 7 GPs who did that course, only 4 ended up doing it. The rest never got into it. Only 4 of us continued the complementary side of it. So that was the start of it. Now, I don't even remember how many other courses or other things I did. We did trigger point therapy, we did osteopathy, we did acupuncture, we did a course in complex homeopathy. We were the first doctors to bring in the heal remedies to Ireland. We were the first doctors to bring Reykjavik remedies to Ireland. So it was great time, and things just, just flowed quite smoothly. Now, over a period of time, things have changed a lot. All the things I wrote prescriptions for, like glucosamine sulfate in 1991, Now it's on prescription. And there are few others I can tell you which have gone on the prescription, which is a good thing for the patients. Nothing wrong about that. When patient comes into me, usually I don't take history. So I just bring them in. The moment the patient walks in, I start observing. And when the patient is in, I just say, listen, you tell me, just put down your name, your address. I let them fill the initial part of the chart. And then I just say, would you mind if I examine you and see what I observe? Because in my belief, I don't know why, that's just a little bit unusual. Maybe there's something, I don't know. But I believe that initially when they tell you about the diagnosis which has been made, I don't know, I get a bit contamination in my head. I just want to have a clear head and think about myself, because my training was more clinical, to do with the clinical aspect of a patient rather than going on tests and stuff. Oh, I still rely on tests, so there's no getting away from it. But I just want to see first what's going on. And once I would just determine what I have seen, I make my notes, and then I sit down with the patient. I'll go through then whatever else is being told. No one patient can have similar treatment, not in my clinic anyway. So a patient who walks into my clinic, I take, I'll give you an example of one of the patients who came to me not too long ago. A lady, 52-year-old lady, came in with a lot of stomach problems. And she was diagnosed with irritable bowel. She had also been put on antidepressants and some anxiolytics. She was about on 6 or 7 medications. And when she came into me, she said, Doc, I'm just fed up. Her husband was with her. And I asked her a few questions, and I said, what's going on? Could you tell me? I couldn't figure out, why things weren't working for her. So on the 3rd session of her acupuncture, I always talk to them a little bit more. So she sat down and told me that when she was younger and she had got married, they had moved to England, she had a miscarriage. But she miscarried at, I think, 7 or 8 months. And they never showed her. They just told her it was a boy. But they never showed her, and they never told her about the grave. So after sitting down, having a chat about that, I said, now look, if I was you, I would go back and try and see if you can visit that grave. I'm sure they have some kind of a record. That lady, I saw her after a month, no symptoms, no medication. That's only one example, because you see, my time in psychiatry, whatever it gave me, it just I cannot tell you that how much important it had been for me and for my patients. And then afterwards I went over and even did extra postgraduate course in CBT, which you know, cognitive behavioral therapy, as well as mindfulness, and medical mindful nutrition, which I find excellent. I've also done a course in trigger point therapy, but I have developed my own system of neuromuscular trigger point therapy. And it just happens that a friend of mine visited me in Galway not too long ago with his wife, and she was there, and I was able to it wasn't just a patient doctor relationship, we were just talking, so I just showed him how to do some therapies on her, and she's here, so I might ask her to even tell you a little bit about therapy in a little while, if she's okay with it, of course, with her consent. Now, about a few of the cases I have picked up, and I'm going to tell you about those cases. I'm not very big at technology. I just do it as it is. Now, the first patient I picked for low-dose medicine was a 51-year-old lady, a keen golfer, but her main issue was weight. She had bilateral ankle edema, and she had also a little non-healing ulcer on her left ankle, or just it's in the medial aspect above her left ankle. She had stopped playing golf. She was having a lot of problems. Oh, yes, she had a big, huge issue with her appetite. She just couldn't stop eating bread and spuds. So, and she didn't care about meat or anything else as long as she got bread and spuds. And her weight was piling up. So when she came into me, I treated her, gave her advice on nutrition. I forgot to tell you that I also have a clinic. I've been treating gut health and microbiome restoration again since 1989. And every patient who comes to me, I evaluate them for their gut health, and I look at their digestive system very close. So I treated her with some probiotics and gave her the advice on nutrition. But she was still not giving me the results I was looking for. So I started her. At that time, I was introduced to low-dose medicine and Guna products. So I started her on some Guna products. So the first product I gave her was cholesterol. Second one was Guna Basic. The third one was Guna Dior, which is diuretic. And I was still not getting any results. So the fourth one when I added was Guna Bowl. And that's when the magic happened. So I don't know if it was a coincidence or if it was the build-up of the other three and the combination, but believe me, it was amazing. Within 6 to 7 weeks, that lady started playing golf again and ulcer had healed. Now she was still having pain, she still had pain, and her ankle, I still remember her telling me, "Doc, it's still creaking every time I walk, but it's not hurting me." And it still was swollen. It was the left ankle. So I continued with the treatment, and I was in touch with the Guna crowd, and I can tell you something, folks. If you are thinking of Guna crowd, they are second to none. They always there to help you. I really mean it. And I am one awkward customer. If a patient needs something, they will tell you. He'll just ring up and say, "Well, I need this." And that's it. But they have been just wonderful, really wonderful. Going back to it, so the lady now plays golf again, and she's very happy in herself as well. Oh yes, I added then afterwards, she was having some family issues, not really family issues, with a worker in their office, and so I started her on Guna Mood. So my first patient with low-dose medicine, that lady gave me such a confidence, which is just amazing. So that was my first patient. Now, another patient I want to tell you is, which is really magic. A 68-year-old gentleman came in to me about 3 months ago, with unexplained cough, productive cough. So he was bringing up spit. It was just, white sputum. He had been asthmatic since he was a child. He was always on inhalers, 2 inhalers since his childhood. He had been under control till about 3.5 years ago. And 3.5 years ago, he started this cough, which he never had before. Now he had attended 2 different consultants, respiratory consultants, and eventually the last consultant told him that, look, you just have to live with it. So for some reason, he came over to me, and I looked at him. Again, all the other things I do, but I started him on Guna. When I gave him Guna, I gave him the remedies which was for drainage, lympho, matrix, because he was a chronic case as well, so matrix is indicated. And oh yes, he had big difficulty with sleep as well, partly because of cough and partly because something was going on in his life as well. So I started him on Guna Sleep, but still his chest wasn't giving me the results. This is the first month. When I was being taught, first time, that was in Dr. Dunphy's, Sean's clinic. Ladies from Guna came up. I always mix up their names. One is Elena, and give me the name, please. Evelina. No, not Yelena. So she was there, and she was telling me about a case. She had a difficult case with chest problems, and she says, and this was nearly 6-8 months, a year ago. And I still remembered, she said, I gave him Guna Baul. And when she was telling me that at your office, I was saying, Guna Baul for chest? What's going on? I put that man on Guna Baul, and I tell you, for the last month, he has stopped using inhaler. First time in his life. And thanks to you. So, yes, that is the second case. Now, he's a keen gardener. The other day, he brought in a picture of this big rock he dug out of his garden. And he said, Doc, I was able to do without inhaler. And I just said, man, I have a lot of work to be done in my garden. If you have a few hours. So it was just one of the most amazing experience, and very satisfying. This guy, extremely satisfying. So look, we get good results, and we get pretty good, I get about maybe 65% results. When I do combination of different things. And I never stop their traditional or conventional meds. I never. I just say, you continue that, you talk to your GP. If you want to make changes in it, if you don't need it, you don't have to come. You don't have to worry about it. This is all complementary stuff. And whatever. Oh yes, I also taught, because I have worked in chest medicine, I also taught him how to do chest, his wife to do the chest physio. So, and she was very kind. She came in and she learned, and she's doing it diligently, and I feel that is also doing a lot. And he's a much happier man than when I saw him first 3 months ago. Another gentleman, he's in his 50s, a farmer who had to retire early. He retired early because he was having problems with diarrhea. And he had great difficulty going out because he had to run for the loo. And he soiled himself a few times, and it just affected him mentally big time. So he became a recluse. And why he came to me about this issue? Because 22 years ago, he had come to me for back pain, the same gentleman. So he says, I don't know, I'm just thinking you only treat backs. I said, no, I just don't. What's the problem? He says, my tummy. So I went on and spoke to him about it at length. To me, maybe you might disagree with me. To me, any trauma in life affects you. Any trauma. Could be physical or emotional. And I go into depth with any history of trauma. When a patient comes to me, I say, listen, I want to ask you this question. You don't have to tell me what the trauma is. If you want to tell me, that's okay, but you don't have to tell me what your issue was, when. And would you believe it? 99% of the people will tell you. Not maybe in the first session, second or third, when they have a bit of confidence in you. So this gentleman told me when he was young, he was severely beaten in the dormitory by whoever was running the dormitory at that time. And they would keep him standing to the wall and don't let him go to the bathroom. And he says, Doc, I have never ever forgotten this. Oh, by the way, he was the only child as well. So I had to work a little bit hard and, do a couple of different combinations of treatment, and he wasn't giving me any results as good as I wanted. So I started him on Guna again. And at the same time, I was also working on his gut health. About nearly 4 to 6 weeks after I started him on Guna, the Guna products I gave him was Guna Digest, Guna Stomach, Guna Bowel, Guna Mood. So those were the 4 products I gave him. Lo and behold, it was just amazing. Again, the guy, one of those guys who wants to say he's better, but he doesn't want to, in case it just comes back again. So he says, Doc, I'm nearly afraid to say it, but I feel a little bit better. So, do you think it's going to come back? I said, well, we'll deal with it when it comes back. It's okay. Don't be worrying about it. And it did come back. Then he told me that prematurely he went and, I had stopped his drink. Forgot to tell you. He was drinking a little bit too much because, he was at home and he had no cattle left. He had only one small dog. So he had gone to some place and he had had a drink. And one drink brought it back. So I just said, look, man, you just take that lesson and just forget about the drink for a little while. So he did, and he continued to do well. For the last 3 months, I haven't seen him, but he rings and just says, Doc, can I come back if I need to? I just say, yes, you can come back whenever you want to come back. And he's still on the remedies, and he's a very happy chappy. Oh, by the way, the last time he was into me, he was saying to me, Doc, you've done a great job. I'm nearly cured. Can I ask you a question about something else? So I thought maybe he was going to ask me about his cousin or somebody. And he says, look, have you any cure for fleas of my dog? I just looked at him. He says, they've told me a few things. I put collars on him. I put this and that on him. So I just said, I'm sorry. But I just said, so to myself, I'm going to ask the Gura ladies in case they have something. Now, what I'm going to do is, I'm going to ask that lady if she's okay to come and just tell you about her experience in my clinic. This wasn't, by the way, this wasn't arranged. I didn't even know she was coming here.
Yeah, that was not arranged.
Absolutely.
And thank you very much. Yeah, it was a big pleasure meeting Doctor at this clinic, and straight away I felt like really cares after like he cares about me and asking all those questions and about my life and ignoring, as you said, Doctor, all diagnosis or anything. And the few things really changed my everyday life, and one was advice about my dietary issues, and I stopped eating beef and pork, and actually that really changed. And I thought, I don't feel such a big change, but then one day I had pork, and I felt so bad, and now I know what Dr. Bhatti meant, that pork and beef was really not for me. And as always happens when you go to a really genius doctor, like simple things can change a lot. And Dr. Bhatti showed me a tapping technique for.
That's my neuromuscular technique. Yes, tapping, absolutely.
Tapping,
Now, she told me that, sorry for interrupting you, she told me there that, she's finding it hard to sleep and to relax. So her husband, which is Dr. Modestus, who was here, so I just said I'm going to teach you how to do this. And while he was doing it, she nearly went to sleep.
Yeah, I thought, okay, you guys keep talking, and I just I need 5 more minutes. That's why
I could see her, saw her eyes, and I just said, are you feeling sleepy? She said, yeah.
Actually, I was dreaming again.
Absolutely. Before you go, I'm going to teach Modestas again about doing those techniques.
Yeah, that would be really helpful.
Doc, do you mind?
And as we all know, it's very difficult to treat family members. Doesn't matter what you do in your day when you come home.
No, I don't do that.
But,
Our son is doing.
it's with teenagers. And
Oh, just another treatment I do in my clinic is abdominal manipulation. So I learned this long time ago from a chiropractor. His name was Dr. Kippenbrock, and he was a pioneer, literally a pioneer. And he taught us the abdominal manipulation, and it is so easy, and it is brilliant for anybody who has problems with the visceral area. And it's just one of those techniques. If all else fails, I just go back to it and I rely on it. And usually I also teach patients. Whenever patients come to me, I teach them. I make sure, I always tell them about the acupressure points. I always tell them about the tapping. And if the family member gets involved, that's even better. It's just and I think it just brings the family a little bit closer as well. I really think that helps a lot. Now, I don't want to ask you the questions about your thing. So at the moment, any residual symptoms? I mean, you were telling me that you have improved a lot. Oh, by the way, my session with all lasted was 15 minutes. That's all. She had just come in and they had asked me a question. It wasn't that I was expecting her to see as a patient. So 15 minutes, and I told Doc about what to do, and that was it. So I'm going to ask her any residual symptoms. At the moment, what are the main symptoms? And another thing I just noted since she was here, that she has lost weight, especially in her face. Initially, when I saw her, I didn't recognize her. And this was only a month ago, a month and a half ago. So, she has done very well on that diet. I said to her, I tell my patients, I said, now pig and cow are not your friends. So try and keep away from them as much as possible.
Yeah, about symptoms, heaviness in my tummy.
Tummy?
And, acid reflux at the moment. Yeah.
Okay, so guna reflux. Ladies, are you guna reflux? Please, and maybe guna digest as well. Please, if you don't mind. Anything else? At the moment now, I cannot examine you. That's the only thing. So no. Is that
Yeah.
okay? Next, you're coming to see me anyway next time.
Yes.
Whenever you're going to the work, yeah, and then we can take it from there.
Thank you, Doctor.
Is that okay?
Yeah, pleasure.
Thank you so much. See you, Doc. Take care, buddy. And his lecture was immense. Absolutely. And this doctor was amazing. He was fantastic, and his injections, nothing like it. But I'll tell you something now. We couldn't do without Sean. Honestly. I mean, I wouldn't have been able to give this talk, after such a long day. It was his exercises and whatever else just brought us up here. And thank you, Doc. Thank you so much. I thank you all.